So, in this week's release of IHME's analysis of the epidemic and forecast through to October 1st, we see a sort of divergence between the global picture, where daily cases and deaths that are reported are declining. But when we look country by country, we see a large number of countries where transmission is increasing. And the countries with increases in transmission are in all regions. So, for example, we see some states in the US, multiple states in Mexico with transmission going up, a number of countries in Central America, multiple states in Brazil still going up. Many parts of West, East, Central, and Southern Sub-Saharan Africa, transmission is increasing. Particularly remarkable increases in Rwanda, in Zambia, in Zimbabwe, Uganda, and a number of other countries as well. We're seeing increased transmission in countries in Southeast Asia that have done a very good job up till now in controlling transmission. So these are places like Vietnam and Cambodia and Thailand, as well as ongoing expansion of transmission in Indonesia. We're even seeing some transmission in provinces in China. And when we look within Europe, where generally seasonality in vaccination has brought cases and deaths down sharply, the standout exceptions to that are the United Kingdom, particularly Scotland in the United Kingdom, Portugal, and Russia, all of which are demonstrating that B.1.617.2, or called the Delta variant now by WHO, has the capability to increase transmission even in the summer season in the Northern Hemisphere. So our models suggest that given everything that we currently know and our assumptions about the transmissibility of the Delta variant and the immune escape of the Delta variant, that the global decline, albeit more slowly, should continue. But it's very easy with alternative assumptions on transmissibility or immune escape for the Delta variant to see wider spread surges in Europe, in the United States, due to 617.2, the Delta variant, and of course the ongoing surges in Sub-Saharan Africa, Southeast Asia that are likely Delta variant related as well continuing. So a very critical time in watching the epidemic and trying to understand the full import of the new variants, particularly in a time when I think many expected that rising vaccination, highish levels of past infection. There are countries like Russia where 75% have already been infected that are still seeing increases. And so it does show that while our mainstay strategy has to remain vaccination, reaching those that are hesitant, we're also going to need to go back to what's worked in the past year when needed, mask use and stronger social distancing measures if and when deaths and hospitalizations start to go up in different countries. So I think the main message from our analysis is we shouldn't be talking about a post-COVID world. We're right in the middle of the COVID pandemic. And if anything, there's the very real risk that in the months ahead, particularly as we head into the fall and winter for the Northern Hemisphere, we might actually see a quite considerable surge.